High blood pressure or hypertension is often called the silent killer. Why? Because it usually has no symptoms. Yet, over time, it quietly increases the risk of life-threatening conditions like heart attacks, strokes, and kidney failure. So here's the big question: hypertension medication, why must it be taken long-term? Let's break it down. When your blood pressure is consistently high, your heart has to work harder to pump blood through your body. That constant pressure damages your arteries, making them less elastic and more prone to blockages. Over the years, this leads to cardiovascular disease, one of the leading causes of death worldwide. The good news: antihypertensive medications, drugs that lower blood pressure, can significantly reduce these risks. According to large-scale studies like the Systolic Blood Pressure Intervention Trial, SPRINT, even modest reductions in blood pressure can lower the risk of heart attack, stroke, and death from cardiovascular causes. But here's the catch: these benefits don't come overnight. The protective effect of blood pressure medication builds over time. That's why it's not a short-term fix. It's a long-term commitment. Even if your blood pressure improves, that doesn't mean you can stop your medication. Think of it like this: the medication isn't curing high blood pressure, it's controlling it. Once the medication is stopped, blood pressure often rises again, and with it, the risk of serious complications. When are antihypertensive medications used? Understanding when to start blood pressure medication is crucial. Blood pressure has two numbers: systolic pressure, the pressure when your heart beats, and diastolic pressure, the pressure when your heart rests between beats. For a healthy adult, the ideal blood pressure is systolic 100 to 120 millimeters of mercury and diastolic less than 80 millimeters of mercury. Now, mild hypertension is when the systolic pressure is between 120 to 129 millimeters of mercury, while the diastolic pressure is still less than 80 millimeters of mercury. Hypertension, or high blood pressure, is diagnosed when the systolic pressure is above 130 millimeters of mercury and the diastolic pressure is above 80 millimeters of mercury. So, when do doctors prescribe medication? Well, for borderline hypertension, which is when the systolic pressure is between 130 and 139, or the diastolic pressure is between 80 and 89, medication is generally reserved for people who already have heart disease or other risk factors. For others, lifestyle changes like healthier eating, exercise, and reducing salt intake are the first steps. Established hypertension, which means having a systolic pressure greater than 140 or a diastolic pressure greater than 90, is a critical stage. At this point, antihypertensive medications are strongly recommended for everyone. This is because the risk of serious complications, like heart attacks and strokes, rises sharply. The treatment aims to prevent these events and reduce the risk of death. Severe hypertension, defined as a systolic pressure greater than 180 or a diastolic pressure greater than 120, is considered a medical emergency. Immediate and consistent use of medication is critical to prevent life-threatening complications. Taking antihypertensive medication properly is just as important as taking it at all. Here are the key principles you need to follow for effective and safe treatment. Take your medication at the same time every day. Morning is usually best. This helps your body absorb the medicine optimally and helps you build a routine so you don't forget. Follow your doctor's instructions exactly. Never stop taking your medication just because your blood pressure feels better or seems stable, unless your doctor says so. Stopping medication suddenly can raise your risk of serious complications like strokes. Don't change your prescription or share your medication. Each treatment plan is customized for your unique condition. What works for one person may not work or could even be dangerous for another. Combine medication with healthy lifestyle changes. Medications work best when paired with habits like eating a balanced diet, reducing salt intake, exercising regularly, and quitting smoking. Control other health issues that can affect blood pressure. If you have conditions like high cholesterol, diabetes, or kidney problems, managing these along with your blood pressure is vital to avoid complications. Some blood pressure medicines can cause side effects. If you experience anything unusual like dizziness, swelling, or severe headaches, reach out to your doctor immediately. Don't ignore these warning signs. A very common question is, if my blood pressure is normal now, can I stop taking my medication? The answer is no, you shouldn't stop your medication without your doctor's approval. Here's why. The goal of treating high blood pressure isn't just to lower your numbers for a short time, it's to prevent serious complications in the future, things like heart attacks, strokes, and kidney damage. Antihypertensive medications work by controlling your blood pressure continuously to protect your organs. Even if your blood pressure has stabilized and you feel healthy, stopping medication on your own can cause your blood pressure to rise again. This stops the protective effect of the treatment and increases your risk of dangerous events. In fact, hypertension treatment is usually a lifelong commitment. Maintaining consistent medication use helps limit the progression of the disease and lowers your chance of recurrence or complications. So, keep taking your medication as prescribed even when you feel fine and your blood pressure is under control. If you ever want to adjust your treatment, talk to your doctor first. Stopping your blood pressure medication suddenly can be very dangerous. Without medication, your blood pressure can quickly spike and go out of control. This sudden rise puts extreme stress on your arteries, causing permanent damage over time. One serious risk is the development of an aneurysm, a dangerous bulge in an artery wall. While aneurysms most commonly occur in the aorta, they can form anywhere in your body. If an aneurysm bursts, it can lead to life-threatening bleeding. Suddenly, stopping medication also dramatically increases your risk of heart attack, stroke, and other cardiovascular emergencies. That's why it's crucial to never stop your medication without consulting your doctor. What are the risks of not treating hypertension? Ignoring or not treating high blood pressure can have serious, even life-threatening consequences. When blood pressure stays high and uncontrolled, it puts constant strain on your arteries. Over time, this causes your arteries to harden and thicken, a condition known as atherosclerosis. This damage can block blood flow or cause clots, leading to major complications like heart attacks, strokes, and other cardiovascular problems that can severely impact your quality of life or even be fatal. Simply put, untreated hypertension silently damages your body and dramatically raises the risk of these dangerous events. Managing hypertension: why lifestyle changes matter. Medications are important, but lifestyle changes play a crucial role in managing high blood pressure, and sometimes can even reduce or delay the need for medication. Here's what science recommends for a heart-healthy lifestyle, heart-healthy diet. Adopt diets like the DASH diet, which emphasizes plenty of fruits and vegetables, low-fat dairy products, and lean proteins such as fish, eggs, and soy. Limiting sodium to less than 6 grams per day, which is about a teaspoon, is also crucial. Avoid processed foods, sweets, and saturated fats. They raise blood pressure and harm your heart. Regular physical activity. Aim for at least 150 minutes of moderate exercise or 75 minutes of vigorous exercise per week. You can break this into shorter sessions. Walk, jog, cycle, or swim. Every bit counts. Maintain a healthy weight. Even a small amount of weight loss can make a significant difference in lowering blood pressure if you're overweight. Limit alcohol and caffeine. Keep alcohol to no more than 14 drinks a week for men, 7 for women. Cut back on caffeine from coffee, tea, or soda. Too much can raise your blood pressure. Quit smoking. Smoking damages your blood vessels and raises blood pressure. Quitting is one of the best things you can do for your heart and overall health. Manage stress. Stress can cause temporary blood pressure spikes. Try relaxation methods like deep breathing, meditation, or yoga. Identify what stresses you out and find healthy ways to cope. Get enough sleep. Aim for 7 to 9 hours of quality sleep every night. Poor sleep can negatively affect your blood pressure and heart health. By making these changes, you support your medication or even prevent the need for it and protect your heart for the long haul.